is Morgan Stevens, and I'm a PN student at Wilson State College. Today I'll be showing you how to perform apical, oral, and transdermal medication. Now before I can enter my patient's room, I'm going to take a check at my healthcare provider's orders and my MAR. So I have my MAR pulled up on my screen. So right here, so first of all, my patient's name is Shirley Cost. So perfect, that's what I have right here. She's a 33-year-old female, perfect. And then date of birth, 4/03 of 1987. Okay, sounds good. Everything's checking out. And then she was admitted today with pneumonia and then a secondary diagnosis of congestive heart failure. So I'll be aware of that. And if I had any questions with these medications, I would call the provider or I would reassess and get more information. So my first medication that I have is my fentanyl patch, my fentanyl 50 microgram transdermal patch. So, okay, so I have that, and that's for twice a day, and then rotate sites. So the last site was on the right upper back, so I'll be changing that, and it is currently 8:55, so I'm still within the 30 minutes, so perfect. And then for Shirley Cost, so everything's checking out good, okay. And then next, on to my next medication, I have Augmentin, 600 milligrams by mouth, twice a day for 7 days. And the first dose was 3 days ago at 9 o'clock. So I know that, and then we've been doing that, so today's the 3rd day. So it is okay for me to administer because it's still 8:55, so perfect, and for Shirley Cost. And then the fentanyl patch is for pain for Miss Cost, and then the Augmentin's antibiotic. And then for ibuprofen, that's as needed, and then the digoxin is for her congestive heart failure. So next we have our ibuprofen, 400 milligrams by mouth every 8 hours, PRN as pain, so I'll be assessing that. And it has been more than 6 hours, so I am able to administer that if Shirley needs that. And then next, my digoxin, 200 micrograms by mouth daily. And I'll need to assess her apical heart rate before I can administer that because it needs to be greater than 60. And then for 9 o'clock, perfect, Shirley Cost. So everything matches out, so I'm able to put this away. So now that I looked at that and got aware with my patient, I'm going to perform hand hygiene when I enter. So perform. Hi, Mrs. Cost. How are you? Oh, you're in a bit of pain? Is your day going okay? It's all right? Okay. I'm just going to verify with my MAR your date of birth. Okay. 4/03 of 1987. Perfect. And then what's your full name? Shirley Cost. Perfect. And then your do you have any allergies, Miss Cost? Okay, you do. So you have your penicillin and codeine. Okay. So I see that right here. So all your medications today have no interactions with that, so we don't have to worry about that. I'm Morgan, by the way, sorry. I'm going to be your student, and I'm going to be helping you with your morning meds, okay? Okay. So I hear you're in a little bit of pain. Okay. You are. Where is that pain located? Your back? How long has that been going on for? About a couple days? Oh, really? How long does it usually last? About 2 hours? Ooh, what makes your pain better? Okay, an ice pack or a hot pack? Laying down? What makes your pain worse? Getting up and moving and, okay, and then what does your pain feel like? Is it sharp? Is it throbbing? It's sharp? Okay. And then, Shirley, do you know on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever experienced, what you would rate it? Okay, a 7. Okay, so you're in quite a bit of discomfort. Okay, so I'm just trying to remember you do have your ibuprofen, so we will I'll reassess when I come back in, but I'm just gonna take a look at and hear your lung sounds because of your pneumonia, and then your apical heart rate, okay? So let me just get these on. And then I'm just gonna move your bed up just a little bit, okay? So I get a better sound. Okay, so first I'm gonna take your apical heart rate, okay? So sorry, Shirley. I'll try and keep you as modest as possible. Okay, so I'm going 5th intercostal, okay? And then I'm gonna listen for about a minute. Okay, so I listened for about a minute and Shirley's pulse was about 73. So that's good because that means we can still administer her digoxin. Are you still doing okay, Shirley? Okay, perfect. So I'm also gonna listen at your lung sounds, okay? To see how your pneumonia is doing. So I'm just gonna take a listen. Okay. Okay. And then I'm gonna get your posterior lung sounds as well. Okay. So I still hear a little bit, but it's not as bad as previously, so that's still good. So Shirley, do you feel able to swallow today? Okay, you do. Okay, perfect. Would you like some water with your meds? Okay, sounds good. Okay, Shirley, so what I'm gonna do, since we got you assessed and rated your pain on a 7, that we'll just be heading back, and we'll be I'll be going through your meds, making sure I have everything, and then I'll be bringing that back. Okay? Okay. So here's your call light, Shirley. Would you like your bed raised down a little bit? Okay. Just a little bit. Perfect. Okay. So I'll be right back. If you need anything, just let me know. So now I am out of Shirley's room. And I am just looking at the MAR. Okay, and so I'm gonna just be doing my first med check. And before I do that, I'm just gonna grab gloves so I have them here. Oh, there's no gloves, so we'll just pretend for this demo that I have some. Okay, so we're going to be doing our first med check, so I'm going to get out my fentanyl patch. So fentanyl transdermal patch, perfect, twice a day, so it's still 856, so it's good, 50 micrograms per hour, perfect. So I have that, and I've checked that the bin is with Shirley, so Shirley costs $4/3/1987, so that's matching, so perfect. And then there are no tears or anything. And the expiration date is 2064, so that's good, okay. And then next I have my augmentin, and so that's going to be 600 milligrams by mouth, twice a day for 7 days, and today's the 3rd dose, okay. Expiration date is 2023, so that's good, okay. And then that's still for Shirley cost, and that can be administered at 9 a.m. So perfect. So next we have our ibuprofen. Okay, perfect. So we have our ibuprofen right here. So 400 milligrams by mouth. Okay, perfect. And then every 6 hours for pain. So sounds good. And then the expiration date is 2036. So good, no tears or anything. 400 milligrams. So that is good. And then we have my digoxin. Okay. Okay, so with my dimensional analysis, I know that 250 micrograms is 0.25 milligrams. And so this is just 1 tab, so perfect by mouth, and at 9 a.m. So that's perfect. Okay, so let's see. And I have that, perfect, Shirley Cost. Okay, so I'm good with that. And then once I've done that, now I'd be putting on my gloves, and I'm gonna be doing my second med check. So I'm gonna be getting my fentanyl patch out. So, okay, fentanyl, 50 micrograms per hour. Okay, perfect. And then transdermal twice a day at 9 a.m. Shirley Cost. Okay, perfect. So I'm going to lay that there and then get my tape and pen ready for that. And then next I'm going to move on to my augmentin. And then with my dimensional analysis, I know that this is 7.5 milligrams. So 7.5 milligrams, and then by mouth, twice a day for 7 days, and the expiration date 2023. So that is good. So then I am going to be pouring my augmentin. So I have my gloves on, and then I wipe the top of this, and then when I hold this, I'm going to hold this like this so I do not pour anything. And then I'm just going to give it a good little shake. I'm not going to do it too vigorously because I don't want to like cause any disturbances or anything, but I'm going to give it a good little shake. And then once I see it's all the same color and all diluted, then that's good to administer. So I'm just going to be double checking everything. 600 milligrams, perfect. 9 a.m. Shirley Cost. The expiration date is good. So I'd be wiping this, and then I'm going to hold it with the label like this. And then I'm going to be at eye level, and then with the meniscus right at the top. Okay, so you can see that's 7.5. Kind of hard to tell with the wipe, but then I'd be wiping this, putting this back in, and then I'd be setting this right over here. Perfect. So I have my augmentin, and then nextly I would move on to my ibuprofen. So 400 milligrams every 6 hours, and then Shirley did say she was in quite a bit of pain, so I'd be able to administer them. Expiration date is 2036, so good. Shirley Cost. And then I'm just going to be taking these and then grabbing one of these and then opening this. And making sure, so perfect. So I got one. So I'm going to put that in there, and then I'm going to put my cap on, make sure that's tight. And then I could label this, but for video purposes, I'll just verbalize that. So I have my ibuprofen, and then lastly, I have my digoxin. So it's 0.25 milligrams with it, which is the same as 250 micrograms, so perfect. And I'll be reassessing her apical pulse just to make sure I can still administer this, so no tears. And the expiration date is 2039, so it's still good. And then administered at 9 o'clock, so for Shirley Cost, so that is still good. So now I've completed my second check, so I'm going to complete my third check for the medication that I cannot take in the room. So I'm going to be going to my ibuprofen, and this would also be written on my little cup, but for video purposes. So ibuprofen, 400 milligrams by mouth every 6 hours, PRN for pain. Perfect. Expiration date still good. Shirley Cost, okay, perfect. And then you can still administer this at the time. Good. No risks or anything. And then next it would be my augmentin, and that would be 600 milligrams. Perfect. And that would be 7.5 milliliters. Twice a day for 7 days, and the expiration date is still good, 2023. So that is good, and Shirley Cost. So I'm just gonna put that in there. So perfect. And then now I'm able to put this over here. And then we are going to go into Shirley's room. So let me just perform hand hygiene before leaving the room. Okay, perfect. So now we are in the patient's room. Hi, Mrs. Koss. How are you doing? You're doing okay? Okay, let me just verify your name and date of birth with my MAR. Okay, so Shirley Koss. Okay, perfect. And then date of birth 4/03 of 1987. And then your allergies are penicillin and codeine. Okay, perfect. So I know that my medications for today don't conflict with that, so we are good. And then, perfect. So, and then can you just say your date of birth for me one last time? Okay, 4/03 of 1987. Perfect. And then Shirley Koss. Is it all right if I call you Shirley? Okay, perfect. So I've done my hand hygiene and I have my gloves. So what I'm going to be administering first is I'm going to be doing my ibuprofen. So before I do that, I'm just going to, for purposes, I'm just going to be scanning the wristband. And then for this video, we're just scanning the wristband and not the meds. So we're just going to do that. And then Shirley, right before I give you your ibuprofen, I'm just going to be taking your apical pulse, okay? Just so we can still administer that digoxin, okay? And then I'm just going to go down to your 5th intercostal and your mid-clavicular line. Perfect. And then I'm going to be listening for a minute. Okay. So it is 75. So it's good to still administer that. I'm just going to sit you up just a little bit, okay? Is that okay, Shirley? Perfect. Just so you can take your pills and have gravity work with you. Perfect. And then my coworker, Elena, got me my cup of water. Thank you so much. Okay, so now we will move on to my ibuprofen. So I have it on the cup, but we have my ibuprofen, 400 milligrams by mouth every 6 hours for pain. So you're still in quite a bit of pain, right, Shirley? Yep, okay. So do you feel good enough to swallow? Okay. So here you go. Here's your cup of water. Thank you. Just gonna put this in the trash. Okay, so we got that. And I would sign on all of these, and then it's going to automatically do my electronic signature. But just want to clarify that. And then next, I'm going to move on to my Augmentin, 600 milligrams by mouth for 7 days. Okay, perfect. And then it's still about 9 o'clock, so we're still on time. So that's good. So Shirley, that was your ibuprofen for pain. Now this is your antibiotic Augmentin for your pneumonia. So there you go. Here you go. Put that in the trash. Okay. And then next we're going to move on to her digoxin. So I'm going to have my other cup. And then I have my gloves on still. But then I have my digoxin. And then on the label, I've checked that it's digoxin 250 micrograms, which is the same as 0.2 milligrams. So by mouth at 9 a.m. So we're right on time, and our apical heart rate was 75. So we're good to administer. And for Shirley Koss, I'm just going to be putting this in here. Perfect. You still doing okay, Shirley? Sounds good. Here you are. There you are. Be throwing this in the trash. And then, okay, now we're done with that. And now we can go to our fentanyl patch. So we have our fentanyl patch, 50 micrograms per hour, twice a day, 9 o'clock. So perfect. So before I write my name and my initials, the date and the time on this, I'm gonna actually go over to Shirley and get the old one off of her. So I'm going to be taking this off of her, and I'm going to be folding it inside. So I'm putting it in the sharps container. So no one anyone can get the transdermal patch. And then I'm going to be wiping this away, just anything extra. Are you doing okay, Shirley? Okay, perfect. So now I'm going to throw this away. And then I checked this, the expiration date is good. So I'm going to be opening this up. And then I would have changed my gloves if I felt necessary. And then I'll be grabbing this. And then I'm going to be getting my tape. And then I'm going to be writing my name. And then the date, and then the time. Okay, perfect. Just throw that away. Okay, so now I'm going to be placing this on my patch, and I wouldn't really grab it by the hand like that. I would have my gloves on. And since we did that side, and we're going to be doing her right side. So now I'm going to put this right here, okay, Shirley? Okay. And I initialed that and have everything. So how are you doing, Shirley? Are you doing good? Okay, sounds good. And then before I would have administered that, I would have wiped away any excess oil Shirley had on her. And just so that any residue wouldn't inflict with the absorption of the fentanyl patch. And then Shirley, did you swallow all of your meds? You did. Okay, perfect. Do you need any more water? No, you're good? Okay, so I'm going to come back in about 30 minutes and assess your pain, see if that ibuprofen's helping at all. And then Shirley, would you like to be raised back down? No, you're good. You're going to watch TV? Okay, sounds good. So I'm just going to clean up my workstation. I would throw away anything, and then I'd make it all tidy. I would document my interventions. I would leave her call light by her, and I'd provide privacy, and I'd ask Shirley if she wanted anything or needed to leave the door open or closed. Closed? Okay. So I'm going to come back to see Shirley, but that is it. Thank you so much.